Peripheral artery disease, often abbreviated as PAD, is a serious circulatory condition that affects millions of people worldwide. It occurs when the arteries that carry blood to your limbs, most commonly the legs, become narrowed or blocked due to the buildup of fatty deposits, a process known as atherosclerosis. When blood flow is restricted, your muscles and tissues may not receive enough oxygen and nutrients, resulting in symptoms like leg pain, cramping, numbness, and slow-healing wounds. If left unmanaged, PAD can progress to a critical state where tissue begins to die, leading to gangrene or even the need for amputation. However, the good news is that there are many effective strategies to reduce your risk and protect your limbs. The first and most important step in managing PAD and reducing your risk of complications is understanding the risk factors. Age is a major contributor, as PAD is more common in people over 50. Other key risk factors include smoking, diabetes, high blood pressure, high cholesterol, obesity, and a family history of cardiovascular disease. Recognizing these factors and working proactively with your healthcare provider can make a significant difference in the progression of the disease. One of the most impactful lifestyle changes you can make is to quit smoking. Cigarette smoke damages the lining of your arteries, accelerates the buildup of plaque, and significantly increases your risk of PAD-related complications. If you smoke, seek support through counseling, medications, or nicotine replacement therapies to help you quit. The benefits of quitting begin almost immediately, with improved circulation and a reduced risk of further arterial damage over time. Managing diabetes is another crucial element. High blood sugar levels damage blood vessels and nerves, making wounds slower to heal and increasing the risk of infections. Work closely with your healthcare team to keep your blood sugar within the target range. This may involve a combination of medication, regular monitoring, a healthy diet, and physical activity. If you have diabetes, pay extra attention to your feet and legs. Inspect them daily for cuts, blisters, redness, or swelling, and report any concerns to your doctor promptly. Controlling your blood pressure and cholesterol levels is essential for preventing the progression of PAD. High blood pressure puts added strain on your arteries, while elevated cholesterol contributes to plaque buildup. Your healthcare provider may prescribe medications such as statins or antihypertensives to help keep these numbers in check. Alongside medication, adopting a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can further support your vascular health. Limiting salt, sugar, and saturated fats will also help reduce your overall risk. Physical activity is another powerful tool for managing PAD. Regular exercise, especially walking, encourages the development of new blood vessels, improves circulation, and helps reduce symptoms like leg pain and cramping. Begin with short, gentle walks and gradually increase your duration and intensity as tolerated. Even a few minutes of walking several times a day can make a significant difference. If walking is too painful, consider other low-impact activities such as cycling or swimming. Consult your healthcare provider before starting any new exercise program to ensure it is safe and appropriate for your condition. Proper foot and leg care is critical for anyone with PAD. Reduced blood flow makes it harder for wounds to heal and increases the risk of infection, which can lead to gangrene if not treated promptly. Wash your feet daily with mild soap and warm water, dry them thoroughly, and apply a moisturizer to prevent cracking. Trim your toenails carefully and avoid walking barefoot to reduce the risk of injury. Choose well-fitting, supportive shoes and socks that do not constrict circulation. If you notice any sores, blisters, discoloration, or temperature changes, see your healthcare provider without delay. In addition to lifestyle changes, your doctor may recommend medications to help manage your symptoms and reduce your risk of complications. These can include antiplatelet drugs such as aspirin or clopidogrel to prevent blood clots, cholesterol-lowering medications, and drugs to improve blood flow, such as cilostazol or pentoxifylline. In some cases, procedures like angioplasty or stenting may be necessary to open up narrowed arteries and restore better blood flow. In severe cases, bypass surgery may be considered to reroute blood around a blocked artery. Regular checkups with your healthcare provider are essential for monitoring your PAD and catching any problems early. Your doctor may check the pulses in your legs and feet, perform an ankle brachial index (ABI) test to measure blood flow, or order imaging tests to evaluate your arteries. Early detection of changes allows for timely intervention and reduces the risk of serious complications. Maintaining a healthy weight is also important in managing PAD. Excess weight increases your risk of diabetes, high blood pressure, and high cholesterol, all of which can worsen PAD. Even modest weight loss can improve your symptoms and overall vascular health. Focus on gradual, sustainable changes in your eating and activity habits, and seek support from a registered dietitian or a weight management program if needed. Stress management plays a supporting role in vascular health. Chronic stress can raise your blood pressure and make it harder to stick to healthy habits. Practice relaxation techniques such as deep breathing, meditation, yoga, or gentle stretching. Stay connected with friends, family, or support groups to help you cope with the emotional challenges of living with a chronic condition. For individuals with advanced PAD, wound care becomes especially important. If you develop a non-healing ulcer or wound on your foot or leg, specialized care from a wound clinic may be necessary. Prompt treatment of infections with antibiotics and careful wound management can help prevent the spread of infection and reduce the risk of gangrene or amputation. In summary, managing peripheral artery disease requires a comprehensive, proactive approach. By quitting smoking, controlling your blood sugar, blood pressure, and cholesterol, staying active, caring for your feet, adhering to medications, and seeking regular medical care, you can significantly reduce your risk of gangrene and amputation. Remember, early intervention and consistent self-care are your best defenses. Empower yourself with knowledge, take charge of your health, and work closely with your healthcare team to protect your limbs and preserve your quality of life. Every step you take today brings you closer to a healthier, more active tomorrow. To learn more, go to kbfitnesshealth.com.